Ladies and gentlemen, on behalf of my colleagues from the Carnot Institute, or Instituts Carnot in French, it's my pleasure introducing the Carnot network. I will start explaining what Carnot stands for. I will briefly describe our mission and our activities, also our international development, as well as concluding by a brief description of the Global Care Initiative. You certainly have wondered, since you heard of Carnot, what Carnot stands for. In fact, Carnot was named after Nicolas Léonard Sadi Carnot. He could well have been an MIT student. He was a bright engineer and bright student, but he would be the oldest in the classroom since it was at the beginning of the 19th century. But he studied in the famous École Polytechnique in Paris, and like the MIT students and the École Polytechnique, he had a significant interest in industry discoveries. So he started studying steam engines, and he published one single work that was a thesis, then a book about reflections on the motive power of heat and on other machines that develop this power. His investigations led to a so-called Carnot theory that was about improving the efficiency of the existing engines at that time. Further researchers worked on that theory that led to the, at least for engineers, the very famous second law of thermodynamics that in turn led to the development of the so-called practical engines. That includes the diesel engines that we also that we use today. And that was a very good example of industry-driven academic research generating landmark, marketable innovations, and that has been the ground for the creation of the Carnot Institutes. So Carnot Institutes are just about that. What is our mission? Our mission is developing research partnerships with industry and other research and technological organizations so that we can bring together answers to their unmet innovation needs that will have a positive impact on societal or economic items. Carnot Institutes were created in 2006. It was an initiative from the French Ministry of Higher Education and Research in the form of public research laboratories or institutes that were selected for funding through a highly competitive call for applications. Those institutes that were selected and funded had to demonstrate on a daily basis their scientific excellence. They had to have a proven high-level history of research partnering, and they had to demonstrate their professionalism in this area. This is a very original and considered as a very efficient system. You will see the figures afterwards, which is guided by the following principles. All Carnot Institutes have to commit for, very formally, for ambitious objectives regarding partnering research, regarding professionalization, and the refueling of their basic research. So it's not only one-shot research, it's definitely long-term commitment to basic research too. They have to supply the French National Agency for Research with a yearly action plan and budget, and they receive on that basis funding from that agency, but this is only linked to results that are measured every other year based on their research income, IP, publications, and many other criteria. They are supported by a structured network, in particular by the Carnot Institutes Association, which develops collective actions of the Carnot Institutes. And we all respect a Carnot Code of Ethics and Standards. They have to be industry-compatible standards, and that includes intellectual property protection. Currently, there are 34 Carnot Institutes. There is a new call application for applications ongoing, but so far there have been 34 Carnot Institutes. As you can see, they are spread across France, and they represent a significant number of industry sectors, from the nuclear industry towards the automotive industry, fashion and transportation, and many others, of course, including the healthcare sector. We can now claim that we are key stakeholders in the industry competitiveness and economic growth in France. You can see the figures. Altogether, these 34 Carnot institutes represent 35%, €500 million, which is quite similar in US dollars, of all France's public contract R&D with industry. A day, it's more than 1 million euros contract income that are signed with companies. Our consolidated budget is more than 2 billion euros or US dollars, and we represent altogether 15%, 27 full-time equivalents of the French state's research staff. In 2014, our activity led to 20,000 peer-reviewed papers, 65 startup companies created, and more than 1,000 proprietary patents that were filed. And this growth has been continuous, as you can see, since 2010. The contractor R&D turnover has grown by more than 52%. To tell you the truth, when the Carnot Institutes were created, they were inspired by another European model, which are the Fraunhofer's institutes located in Germany. That was the definite model, and we are very proud today to be very close to that model in terms of efficiency. You can see the growth in terms of partnering income from these two networks, and we can see that the performance of the Carnot Institutes is pretty similar to the Fraunhofer's. Partnering with Carnot Institutes may take a lot of different forms. It may be, and it's in many cases, contract research, but we also develop collaborative projects through common calls for projects, be they in Europe or in other countries, joint laboratories, access to advice and expertise, and also access to the many platforms we have in our institutes. Our activities have been growing abroad, not only in France, with a wide range of partnering options, again, scientific expertise, R&D contracts, but also collaborative research projects, international joint units, international associated laboratories, and alliances. And as you see, this has led to many international collaborations. We have a number active here in the US, and the total income in 2014 abroad was 200 million euros or US dollars, with a growth of close to 30% since 2012. Among this growth, collaborative R&D funding, common application to international or national call for projects represented a growth of 11%. These are our international locations in terms of offices, parent organizations, offices. As you can see, we're currently present on the 5 continents. And we have also joint laboratories and R&D corporations in many countries, including, as you can see, of course, the US, which is a major source of collaboration for our institutes. Last but not least, I will say some words about the Global Care Initiative. We can define it as a concentrate of France's research and innovation in life sciences. We are a consortium of 5 Carnot institutes that was created in 2012. All of us are international leaders in human health, and we are addressing major unmet medical needs and present on the top tier pharmaceutical, biotechnological, or diagnostic markets. I will name these 5 institutes, first of them, and also the coordinator of our consortium, Pasteur Institute, like Curie Institute. These are more than famous research entities. You know their history and their role in the progress of science. They are active, respectively, in infectious diseases and cancer. My institute is a leader in hematological malignancies, namely in lymphoma. And as it has already been mentioned, the Institut du Cerveau et la Moelle Épinière, the Brain and Spinal Cord Injury, and Voix et Entendre, Hearing and the Vision and Audition Institute are also international leaders in CNS conditions and vision and audition diseases. Altogether, we represent the Global Partnership Research Initiative of the Carnot Human Health Institutes, and we receive French state funding to develop mutualized international R&D projects as well as business development activities, and this is one example of such business development activities. We aim at fostering unique partnerships with industry and other RTOs through our research and innovation potential. We have in our 5 institutes more than 2,500 researchers, and a large history of Nobel Prizes, especially at Pasteur and Curie institutes, and we currently have more than 5,000 active patents. As far as discovery and critical research are concerned, we have capacity for drug screening, many models, be they in vitro, in vivo, and state-of-the-art platforms that are open for collaborations. Precision medicine is one of our common objectives, with a long history for some of us of clinical research from phase 1 to phase 4 trials that generated unique databases and biological collections, and we need strong bioinformatics capacity to manage and analyze such huge databases. And as far as partnering is concerned, we, of course, comply with industry standards. That is a must for Carnot Institute, in particular in terms of quality assurance, intellectual property. Some of us have incubators and have generated a number of spin-off companies creation. And we have a devoted operational team, including one representative here in Boston. Last but not least, we aim during these 2 days at establishing contacts and partnerships with you and the institutions you represent, be they companies, universities, or other institutions. You can have access to the information of these mentioned websites, but we expect these 2 days to be a source of discussion with our scientific experts who are going to present their activities after me. Our industry partners, a number of them are here in the room and will give examples of such cooperations, and of course our operational team, which I would like to thank for the fantastic job they have done so far to organize this meeting together with the local consulate and the French embassy. And I would like, on behalf of my colleagues, to wish you an excellent French-American Innovation Days 2016. Thank you very much.